Hi, my name is Abija Bobin, a fourth-year medical student at Philadelphia College of Osteopathic Medicine, Georgia. I will be presenting a research on determining an equation to predict COVID-19 cases and deaths via a multifactorial global analysis. This was done in collaboration with Dr. Sibin Bobin, Dr. Blasi George, Dr. Robert DiTomaso, Dr. Michael Roberts, and Dr. Valerie Cadet, all of whom are affiliated with PCOM. The purpose was to predict COVID-19 cases and deaths using hygiene hypothesis surrogate factors. We also hoped to understand risk factors that predispose nations to higher rates of respiratory infections. Finally, we sought to provide insight to World Health Organization, among others, to concentrate their resources toward effective COVID-19 mitigation strategies. The research was conducted by initially identifying surrogate factors for hygiene hypothesis, which includes a breakdown of Environmental Performance Index, along with mortality data due to WASH, or better known as water, sanitation, and hygiene, for a total of 190 countries. COVID-19 cases and deaths were collected from January 4, 2020 through December 28, 2020, which is the initial phase of the COVID-19 pandemic. Spearman correlation analysis of 29 factors were performed and then visualized using a heat map on RStudio. Finally, multiple regression analysis was done, of which the beta coefficients were used to determine a predictive equation for estimating COVID-19 cases for each nation. As you can see in the results section, Table 1 shows that mortality due to air pollution and control of solid waste accounted for 28.3% of the variability in COVID-19 total cases. In Table 2, it shows that mortality due to air pollution accounts for only 9.6% of the variability of COVID-19 total deaths. Furthermore, the unstandardized beta coefficients were used to determine the equation. The equation for estimated COVID-19 cases is equal to 10.534 times the mortality due to air pollution of that nation plus 498,321.18 times the control of solid waste of that nation minus 57,370.23 plus or minus 716,905.12. The conclusion drawn from this research is that mortality due to air pollution and control of solid waste are positively correlated with COVID-19 cases. Only mortality due to air pollution was negatively correlated to COVID-19 deaths. A couple of theories and other findings explain these results. First, denser particles are seen with higher air pollution and thus can persist longer in the air, which allows for higher rates of respiratory infection transmission. Also, people in these areas have a higher chance of compromised lungs and alveoli due to prolonged exposure to air pollution, making them perfectly ripe for respiratory infections. As for the positive correlation seen with control of solid waste, the theory that lack of proper disposal likely contributed to easier transmission of COVID-19 may explain the results. Previously well-functioning control of solid waste disposal systems had significant disruptions as they were left to figure out alternative ways to dispose of their trash due to COVID-19 lockdowns. Although a correlation between hygiene hypothesis and COVID-19 cases and deaths were disproven, the cleanliness of a nation is paramount in minimizing transmission of respiratory infections. Last but not least, the research presented here can provide further incentive for governments to create public policies that seek to minimize air pollution. We would like to gratefully acknowledge Philadelphia College of Osteopathic Medicine Division of Research for funding our research, along with Shinu Thomas and Sayona George for constructing the heat map. The references are provided below for all the data and the explanations.